Good evening, everyone. My name is Brenda Ahlberg, Kenai Peninsula Borough Information Officer, and tonight with me is Dan Nelson, our our incident commander for our team, joining us tonight for an update. And I will not continue to babble. I'm going to just pass it right over to you, Dan. Thank you.
All right. Well, thanks so much, Brenda. Good evening, everybody. Welcome and thank you very much for joining us tonight. So, as Brenda said, I'm Dan Nelson. There's a lot of titles, but we'll just go with Incident Commander for the Boroughs coronavirus response. I just have a few things for this evening, and we can definitely take some questions if you have them. But, it was a day of good preparation and a day of just good work being happening. And really, most of our day with my staff was spent doing some planning and some work with our hospitals. So the three hospitals in the Kenai Peninsula we've been working with very closely on different levels. So Central Peninsula and Soldotna, South Peninsula Hospital down in Homer, and Seward Providence over in the Seward area. And with such an expected impact on our healthcare system and hospitals and EMS, we've been working with all of those agencies on different levels. So I think good progress has been made. We've been making some plans, quite frankly, for what happens when we do have what we call a surge. What happens when we have demand on those hospitals, and how we can make sure that we're taking care of the health of the public and everybody that might be affected by this virus that needs medical care. And of course, all of the things and the medical cases that are seen in the hospitals on a daily basis. So that's the objective, and we're continuing to get those things solidified and in a ready state. As far as just updates for cases today, there were not any new cases announced for the Kenai Peninsula, so our number still remains the same. Governor Dunleavy earlier announced a total of 69 cases within the state of Alaska for this evening. So that was the governor's update from Department of Health and Social Services. We continued, just kind of going down that path of contingency planning and working with our health and our EMS folks. So we continue to work with cities as well as many partners and interested cooperators throughout the Kenai Peninsula and the state. So just quite a number of calls and meetings with state officials, with our State Emergency Operations Center and the Department of Health and Social Services that are working together. So it's hard to make meetings and planning sound exciting, so I'm not going to try and do that, but continuing to work really for the best interests of all of our residents on the Kenai Peninsula in a time of really great anxiety and things changing, certainly hour by hour. We continue internally through here at the Kenai Peninsula Borough, as well as all the cities and tribal nations to work on our continuity planning and adjusting how we're doing business. So just as a reminder, all government services are open at all levels, but you may have some delays in reaching folks or need to get some calls back, or again, having to do business over the phone, online, or by mail instead of that person-to-person contact. So, with that pretty much sums up the update. I don't want to belabor any points. It was a very productive day, but it was also a little bit of a pause, a little bit of a ramp down for things I think for us and jurisdictions around the state, and we are just looking forward and preparing for that curve, whatever that is. We're all working to flatten it, but we know that we certainly still have quite a ways to go in this response and in this journey that we're all in together. So that is my update. I know it's a great segue into maybe talking about tomorrow, Brenda, and maybe some company I'm going to have here tomorrow. So would you mind talking a little bit about what's in store for folks?
Absolutely. We have joining us tomorrow local public health official Leslie Feltz with Public Health, and she is going to provide us an update from her perspective, as well as help answer these questions that we've had throughout throughout our community conversations that we just have not been able to give solid answers to. So we really welcome her being part of the panel discussion tomorrow. And we're also trying to line up other guests for this half hour to get you guys some solid answers. Appreciate your patience. Definitely keep bringing those questions in so that we can prepare and give those to her ahead of time. In addition to that, I did want to share with you guys a couple of questions that are coming in tonight. Or excuse me, share with you, Dan. And one of them that has come up that I know you can't answer is, will there be tests available for everyone?
That is one that I'm not going to be very good at answering, and then perhaps we can save that for Leslie Feltz tomorrow. But
Okay,
right now, with I know with testing in short supply, they're going through that screening, and they have some criteria established. So maybe we can talk with her about the future outlook and if that's going to change sometime.
good to know. One of the other questions that's not in this thread but was asked of me is, there are some of the villages that have restricted access into their communities and want to know why. I know those are Port Graham, Nanwalek, and Port Graham, Nanwalek, and Tyonek. Can you share with us why they have chosen to place restrictions in their communities?
And I can't speak directly for them, but some of the communication and the information we've received is simply to further the objective of keeping the community healthy and stopping the spread of this virus as it comes in. We know those small communities have limited lifelines in and ways to get in as far as commercial air traffic, maybe a little bit of boat traffic that may be happening. But really, they're small communities, they're isolated, they don't have the resources that some of the bigger communities do as far as healthcare. So even though we've been working on some of those plans, it's important to realize for them that some of these cases and people becoming ill might be a little bit more of a difficult logistical challenge to make sure we can get them help and keep them safe and healthy. So those all of those reasons, and I'm sure many more, have really contributed to that decision by the tribal governments.
Right. Going to scroll through questions here, some more questions coming up from individuals regarding our healthcare system or access to equipment. And we're going to take those questions, compile them for tomorrow's panel discussion. And I am going to turn it back over to you so that you have some additional comments for us, and let folks know that we're going to value their time tonight and let them go a little bit early.
Absolutely. So we don't want to keep you here. We do have a half-hour block for this. And of course, remember, we'll be here each night at 7. And of course, don't forget tomorrow with Leslie Feltz from the Division Public Health, Department of Health and Social Services. From the borough perspective, I want to thank everybody that's been doing these things that everybody's been asking of you. Mainly we're washing our hands, we're staying inside, we're helping to flatten that curve. We're continuing to provide all of the support and the planning from a borough level that we're able to do, down to our cities and municipalities and our hospitals and healthcare providers. But it is just critically important that, remember, the ultimate goal here, in addition to keeping people safe and healthy, is we want to make sure that that surge on our healthcare facilities is able to be handled, and that we're able to maintain those services for everybody. So for your neighbor and for your community members, for the healthcare system, for all of these reasons, that's why we're asking you to continue to do these things. And I would share the feeling that I think maybe some cabin fever is settling in, even more than it already is, with a lot of us being inside and using these new technologies, but lacking that face-to-face interaction. And I encourage folks to reach out as much as you can using technology. Maybe go outside for a walk or run or ski while maintaining that good social distancing, 6 feet. I saw some different memes today about different things. I think 6 feet is the length of a moose or width of a moose, something like that. So a lot of creative things out there. But thank you, everybody, for helping us out by contributing to this. The quicker that we can all do these things and flatten that curve, the quicker we're going to be able to get ahead of this and get it resolved in the way Alaskans do. So with that being said, I definitely want to wish everybody a good night. I'll check in with Brenda if there were any last minute questions while I've been talking. And if not, we'll call it a night. And please tell friends about it with Kenai Public Health and myself. I think it'll be a great discussion tomorrow. We might be able to get into some of those questions we haven't been able to get into good detail. So Brenda, were there any more questions or any topics we can answer while we're still here?
There is some questions regarding the person that passed away in Washington versus their residency being in Alaska. Can you provide some clarification to that?
Of course. So we've talked about this a couple times. For folks that haven't been able to tune in, it can be a bit confusing, but basically what this relates to is CDC regulations for how we report data. And there's some pretty strict guidelines on how those things are reported. So we're sure to have accurate data across the board, that we're comparing apples to apples, essentially. So the reason that case, if you look on any of the data, it shows Alaska has had one death, but that individual was out of state, I believe in Washington state. It was believed that contracted the virus and passed away there. But the residency of the individual was Alaska, and CDC's guidelines say that's how it needs to be reported. So just to be clear, as we talk officially in the books, it was an Alaskan death, but the death didn't occur in Alaska, and I believe that we don't believe the virus was contracted here that ultimately caused that fatality. So it's a data reporting regulation, essentially, is what's driving that.
And it looks like there are some folks that are already populating questions for tomorrow's conversation. So I appreciate that. Please keep those coming. I will make sure I cut paste those into a format for our guest and make sure that we have those answered for you tomorrow as best we can. That's all I have for you, Dan, and for our audience.
Well, excellent. Thank you, Brenda. And we'll wish everybody a little bit of a good night. We'll let you get back to your evening. And once again, please join us tomorrow at 7. We very much appreciate the ability to have this conversation with you and for us to be as interactive as we can with questions. So I know we've talked about a lot this week, so we'll end tonight and come back tomorrow night to end that with a great discussion with a very active member of our working group in the local health community. So on behalf of Mayor Pierce and my entire incident management team, thank you so much for watching tonight, and we'll see you tomorrow night right here at 7 p.m.
Good night, everyone.